For this video, we're going to go over the blood supply of the lungs, the lymphatic drainage, the nerve supply, and the pleura. And we're going to start here with the blood supply to the lungs. And in the lungs, we have two functionally different circulatory pathways. We have pulmonary vessels and bronchial vessels. We're going to start first with the bronchial vessels. So the bronchial vessels supply oxygenated blood to the lung tissues with no close access to the atmospheric oxygen for the bronchi and the large bronchioles. So in this particular view, we are observing, if we zoom in right here, this is the aorta. And what we're looking at here, these branches in blue, those are your bronchial arteries. So your bronchial arteries, there's usually two of them. They originate from the descending thoracic aorta, and specifically also the right bronchial artery, which is usually one, and originates from right posterior intercostal artery, and or from a left bronchial artery. So that there's going to be an analog on the other side too. As for the bronchial veins, they do not receive all blood that is conveyed by the bronchial arteries. Some of it's drained by the pulmonary veins and drained into the azygous vein on the right, and or the accessory hemiazygous on the left. Now what we're looking at here on the screen, this is the pulmonary vessels and the pulmonary arteries. Particularly, this would be pulmonary arteries. These are pulmonary veins. So these pulmonary vessels, they convey, for example, deoxygenated blood into the lungs. So that will be your pulmonary arteries. So your pulmonary arteries are the ones bringing the deoxygenated blood to the lungs from the right ventricle of the heart. And in the case of the pulmonary veins, which are these right here in blue, they are draining oxygenated blood from the lungs and carry it to the left atrium of the heart. Now, as for the lymphatic drainage of the lungs, first we have the superficial lymphatic plexus that lies underneath the visceral pleura and it drains over the lung surface towards the bronchopulmonary lymph nodes located in the hilum. And there's also the deep lymphatic plexus that travels along the bronchi and pulmonary vessels towards the hilum, and some lymph passes through the pulmonary nodes located within the lung substance as lymph reaches the hilum, and it also enters the bronchopulmonary nodes. Now, also from the bronchopulmonary nodes, lymph passes through the tracheobronchial nodes located around the bifurcation of the trachea and the paratracheal nodes located along the sides of the trachea. Lastly, the paratracheal nodes can drain into the right and left bronchomediastinal lymph trunks, which in turn drains into the thoracic duct, which is at the left, and right lymphatic duct on the right, or directly into the jugulo-subclavian junction, which is the union of the subclavian and the internal jugular veins at the root of the neck. As for the nerve supply of the lungs, there are two types of supply. There is a sympathetic and there is the parasympathetic. Over here in this picture, you can observe the parasympathetic fibers that originate from the vagus nerves. These parasympathetic fibers cause bronchoconstriction and increase glandular secretion, and the plexus also contains sensory fibers from the bronchial mucous membrane and alveoli. The anterior and posterior pulmonary plexuses contain visceral, sensory, and visceral motor, sympathetic and parasympathetic nerve fibers. Right here we can observe the sympathetic fibers that originate from the upper thoracic ganglia of the sympathetic trunks. And the sympathetic fibers, what they do is they cause bronchodilation and a decreased glandular secretion. Lastly, on this video, let's go over the pleura. The pleura is the serous membrane that is arranged like a closed sac that is invaginated by the lung. So it's a tissue that is protecting the lungs. And it has typically two layers. There is a visceral layer which is going to be the innermost. And this one covers the outer surface of the lung, and it extends into the interlobar fissures. And there's also a parietal layer that covers the internal surface of the thoracic wall and the superior surface of the diaphragm, lateral surface of the mediastinum, and extends into the root of the neck. So that'll be the outermost layer. Both visceral and parietal layers are continuous with each other by the cuff of the pleura that surrounds the root of the lung. For the pleura, the parietal and visceral layers are separated by a slit-like space, which is also known as a potential space, known as the pleural cavity, and this contains a small amount of fluid that follows two layers to move on each other with minimal friction. And so the pleural cavity becomes a real space in certain conditions, such as pathological conditions. Now, if you look on this picture, these are the parts of the parietal pleura. If you notice, there is a costal pleura, which lines the inner surfaces of the ribs, costal cartilages, and intercostal spaces. There's also a diaphragmatic pleura that covers the superior surface of the diaphragm. There is a mediastinal pleura that covers the lateral surface of the mediastinum. And there is a cervical pleura or a pleural cupula that extends up into the root of the neck over the apex of the lung and extends 2 to 3 centimeters above a medial third of the clavicle, where the lung and the pleura may be injured in wounds to the root of the neck or central line placement causing a pneumothorax. Within the pleura, there's also something called the suprapleural membrane, which is a layer of fascia that covers the superior surface of the cervical pleura, and it extends from the transverse processes of C7 to the medial border of the first rib, and it receives some muscle fibers from the scalene muscle that helps to keep the membrane taut. This suprapleural membrane provides support to the cervical pleura in the root of the neck. As for the recesses, there is a costodiaphragmatic recess, which is the lowest part of the pleural cavity. Below, there is the inferior border of the lung, into which the lung expands during deep inspiration, and it's located between the costal and diaphragmatic parts of the parietal pleura. The first part of the pleural cavity, where the fluid accumulation can be detected by X-rays in case of pleural effusion. And there is also a costomediastinal recess, which is located close to the anterior border of the lung between the costal and mediastinal parts of the parietal pleura. And during inspiration and expiration, the anterior border of the lungs slides in and out of these recesses. Lastly, let's go over the nerve supply to the pleura. So the parietal pleura typically is innervated by somatic sensory fibers. There is the costal pleura that is going to be innervated by those intercostal nerves. The diaphragmatic pleura, it's also innervated by intercostal nerves. The mediastinal pleura, it's going to be innervated by the phrenic nerves. Also, that diaphragmatic pleura has a central part that is going to be innervated by the phrenic nerve. And the visceral pleura receives visceral sensory fibers via the pulmonary plexuses, in which the pain is usually not elicited from the visceral pleura. Once the lung disease, for example, involves the parietal pleura, the pain becomes a prominent feature, and the costal pleura has a rich sensory nerve supply, and that's how the patient can be aware of the pain.